Next, I'd like to introduce to you the current APHA President, Dr. Linda Ray Murray.
Good morning, everybody. Welcome to the 139th annual meeting of the American Public Health Association. And this year we gather, as you know, again in our nation's capital. And again, we find ourselves challenged. Our public health infrastructure, both governmental and non-governmental, is no longer crumbling. In many places, it has simply collapsed. That is the issue we will explore next June during our mid-year meeting in North Carolina. It's easy to be lulled into thinking that this time is just another expression of our chronic disease state, being underappreciated, underfunded, misunderstood, and invisible. Much of what we do at these meetings is about that critical public health infrastructure. But these are not usual times. The steady erosion of the foundations of public health and the foundations of our nation force us to declare that the health of our people is in critical condition. I stand before you as a mature health professional. That means I'm getting old. And thus, old folks need to ask each other, are we where we used to be? Are we where we thought we would be? Infant mortality has plummeted for all groups in the United States. But the gap between blacks and whites has not decreased. School counselors have stopped telling young black boys, like my father, you're a bright lad. Maybe when you grow up you can be a shoeshine boy. But in some neighborhoods in Chicago, for every 100 black boys that start kindergarten, only 3 have earned a bachelor's degree by the age 25. The number and percent of black men in medical school has been steadily declining for the past 2 decades. Are we where we thought we would be? We're Americans, and we so easily forget our history. But we should not forget the raping of the land and the forced resettlement of our indigenous peoples and the genocide that the nation perpetrated on them. Not when today we still destroy young Native children by forcibly and illegally removing them to foster care. How dare we instruct the world about freedom and forget our own colonial history and its impact on Mexico, Puerto Rico, Hawaii, and other Pacific Island people. How dare our nation that took centuries to end chattel slavery remain silent about human trafficking and the oppression that it represents, particularly for young women? We are a nation of immigrants, many feeling social and economic despair in their homelands. How can we deny the role that racism has played in our immigration policies in the past, with laws to prevent Chinese from becoming citizens, or the racism of today as we discuss immigrant groups? We ignore the fact that immigrants who come to our nation, work in our fields and factories, pay taxes, and enrich our people. How dare we pretend that simply because some of them have no documents, how dare we pretend that they are the problem? The problem is the hypocrisy of a nation that will not admit that the lack of legal status allows us to exploit and oppress these communities and guarantees a ready supply of cheap labor. We stand here today in our nation's capital as public health workers in a country that still refuses to guarantee health care as a fundamental human right. as we meet, our elected officials are plotting to defund and cripple our most recent attempt at health reform, the Affordable Care Act, an act which on its best day will only bring medical insurance to half of those uninsured. We have been brainwashed to believe that a $1 trillion health care budget cannot provide medical care for every man, woman, and child, and for that matter, every cat and dog in the country. Bullshit. If we would simply enact a single-payer medical insurance system, we could turn our attention to difficult health problems. No, we are not where we used to be, but we are not where we need to be. And it is critical that we understand why and how we can change that reality. Public health, particularly governmental public health, stands in danger of destroying our seed stock. We are training more and more health professionals than ever, but both governmental and non-governmental positions are being cut. Our response as a field has often been to retreat into ever more technical approaches, to believe that somehow data can protect us, and that evidence-based interventions will improve the health of our nation. So we lie to our young. We train them in technical skills when we know that policy is not determined by p-values or by data, but by power and politics. We need science, but not as a shield. It will not protect us from the consequences of calling for the conditions we need to create healthy people and healthy communities. We know that health is determined by, not influenced by, determined by social conditions. That is why social, economic, political, educational inequalities produce health inequalities. I agree with the observation of the World Health Organization in its Closing the Gap report that said, this unequal distribution of health-damaging experience is not in any sense a natural phenomenon, but it is the result of a toxic combination of poor social policies and programs, unfair economic arrangements, and bad politics. And I would add bad science. Science is a toolbox for examining the world. Science is not a monolith. It doesn't exist only in a biomedical paradigm. It's not a religion. It's a process full of a wide variety of methods and frameworks for changing the world. Our present public health orthodoxy restricts our ability to question, to measure, to create new realities. Let us listen to each other. Let us argue with each other. There is more to science than simply p-values and process looked at interventions. Move out of your comfort zone. Listen to your colleagues, especially colleagues in our caucuses of color, and my favorite, the spirit of 1848, as they challenge the proposition that reductionist Western methodologies are the correct tool for every situation. What we have been doing is not working. If we remember our history, we'll find that the doubling of life expectancy between 1850 and 1950 happened because public health was wedded to, embedded in, the social movements of the day. It will not be safe. Use APHA and our sister organizations as your shield. It will not be easy, and progress will not be in a straight line. There will be ups, and as we know, there'll be many downs. But you know what must be done. People must have jobs with economic security and dignity. Today's minimum wage is less than the wage in 1960, Organized labor has shrunk to only 8% of our workforce. But even in its weakened state, unions represent the last bulwark between sanity and chaos. The median wealth for Black families is less today than it was a generation ago. Latinos have lost more wealth in the foreclosure crisis than the entire history of the nation. Progress in the last 100 years, Social Security, health care, pensions, public education, the weekend are being undone. Educational, economic, health inequities are widening. We are moving backwards, some of us faster than others. When I was a little girl, my great-grandmother, who was born just after the end of slavery, often explained to me, "White folks," she said, "will keep you down. They will kick you, they'll knock you to the ground. The only thing you have to decide in life is how often you will stand up." I believe in the lessons of history. That's why I'll be joining our colleagues from this meeting as they march in solidarity with Occupy Washington. History teaches me that when we fight against the oppression of women, when we fight to protect workers and allow them to keep the wealth that they produce, when we fight to end racism, then and only then do we make progress. Public health believes that health is a basic human right. We understand that the health of people and all living things, including the planet, requires peace and justice. Later this week, I will visit the new King Memorial with my grandchildren, and I will tell them what my great-grandmother told me, that if they stand up, we can make his dream a reality. Brother James Baldwin wrote in The Fire Next Time, "I know that what I am asking is impossible. But in our time, as in every time, the impossible is the least that one can demand. And one is, after all, emboldened by the spectacle of human history, and by American Negro history in particular, for it testifies to nothing less than the perpetual achievement of the impossible." You know what we need to do, and you know why. So remember the advice of my great-grandmother and Brother Baldwin. Grab hold of our science and gather our people to fight to make change. Stand up and insist on the impossible. Demand freedom now. Demand peace now. Demand justice now.